shared, and is it visible?
Yes.
Is the screen visible, guys?
Yes, sir.
Yes.
Yes, sir.
Okay. Please respond fast, otherwise they'll have to pay me more. So yeah, we'll start. Uh, yeah, once again, angiography. We have discussed about angiography in the last session. What is angiography?
Examination. Examination of the condition of the cardiac.
Okay, angiography is a X-ray procedure which permits visualization of the internal anatomy of the heart and blood vessels, including artery, veins, and lymphatics. How is it done? Can anybody tell me how is it done? What do you inject?
Dyes, contrast material.
Yeah,
Markers.
material, yeah, a material called as contrast with the radio opaque dye is inserted, and we take pictures using X-rays, and these pictures are called as a fluoroscopic image or a röntgenic image. Who is Röntgen? Is the person who discovered X-rays. Okay, yeah, these pictures are called as this. What is this image that is there over here? Can anybody tell me? What does it look like?
Brain.
Yeah, it's a brain, and they have taken a picture. The parenchyma is not visible, only the blood vessels are being seen. Okay, coming to the indications of angiography, when they are done, we could verify the presence of tumors. How do you verify presence of tumors? What will happen when a tumor is there to its blood supply?
Neovascularization. Increased
Neovascularization,
blood supply.
blood vessels, and angiogenesis takes place, and it is drawing more blood because it does not have control over its growth and replication. Hence, it is drawing more blood, so the tumor will be taking more. How do you think we can diagnose a stenosis? A stenosis is nothing but a thinning of artery. This stenosis, how do you think we can see on an angiogram? They will present as filling defects because the dye will get filled up like this. Okay, and this stenosis can be caused by atherosclerosis, occlusions, or a trauma to the intima of an artery. What are the things you can find out in an angiogram? If it is a clot, the dye will fill up only one side, or if there is a thrombus, embolus, or if there is an aneurysm, what will happen? The vessel will swell up like this, and the dye will be forming a globular-like structure. How do you think we can diagnose heart diseases? One is if there is a heart disease, if there is a growth on a valve, it will also present as a filling defect. Or if the heart has any outpouchings, or the ventricle and arteries have become small, then the filling of these dye in the heart will also be decreased. What is this image? How is it looking like? It's looking like a berry. Okay, this is a berry aneurysm which usually runs in families, and it is seen in the circle of Willis, where if this bursts, it can lead to a hemorrhage in the brain, so that this hemorrhage can cause even death of the patient. Okay, uh, this is all about the indications of uh, angiogram. When it is contraindication, one is there is a severe anaphylactic reaction to the iodinated contrast. As I told you, iodinated contrasts are used here, barium contrasts are used for GIT, which examples are iohexol and iopamidol. Okay, these are two, you don't have to remember the name. And if there is any coagulopathy, what are coagulopathies?
Disorder of coagulation, DIC.
Excessive or less dilution. Can you name some example? of coagulopathy?
DIC, sir.
DIC is a coagulopathy, yeah, disseminated intravascular coagulation, correct. Other than that, hemophilia, royal disease, King's disease, that is also a coagulopathy, where there is no clotting deficiency of certain clotting factors in the which is running in families. This was seen in the royal Britishers who married their own relatives to maintain the purity of race. Uncontrolled hypertension. Why can't we do an angiogram in uncontrolled hypertension? Yeah, it will bleed. Why can't we do it in a renal function if it is impaired? Why can't we do? Because kidneys are the structures that are excreting the contrast, and if kidneys are damaged, the contrast will not get excreted and it will get collected in the body. What is the normal creatinine, guys?
0.6 to 1.5 milligram per deciliter.
Yeah, 0.6 to 1.1 or 1.5, that is correct. And this thing, why we need to important is when we administer a drug which is excreted by the kidney. Suppose I want to do angiography or I want to give him an antibiotic which is excreted by the kidney. What I'll do is I'll calculate the clearance, and if the clearance is reduced, I will reduce my dose so that the concentration of the drug in the blood will reach at minimum concentration. Suppose I'll give an example. If X drug is excreted by the kidney and his creatinine clearance is increased because of some pathology he has in his kidney, what I'll do, I will either give half the X dose or 1/4 the X dose, which is reaching the same therapeutic concentration because of less amount of excretion. So it is true with angiography. Okay, inability to undergo surgical procedure because there is no use of an intervention. Pregnancy, why can't we give this angiogram? Why you can't do in pregnancy? Because you are giving, one is iodinated contrast, which is contraindicated. Also, you are facing in for X-ray, which is again a contraindication. What will happen if you subject a pregnant woman for repeated X-rays?
Fetal anomalies, sir.
Fetal anomalies can happen. Active infection. Why can't you do an angiogram in an active infection? Because when you give a contrast, first of all, the body immunity might be low, and that infection can get spread to any other part of the body. Okay, with this we have already discussed, and you can just look at the slide. Contrast media. What is the ideal contrast media? It should have high specificity and high radio opacity. That is, it should be able to have the property to block the X-rays, and also it should go to the organ which you want to see. Also, it should have a low toxicity. That is, it should not damage the kidneys or it should not damage the liver, and it should not kill any viable cells of the body. It should have low viscosity. That is, it should not form an emboli or it should not form a thick coagulation substance. Actually, in real life, there is nothing called as an ideal media, which take most of the properties. We consider it as an ideal media. In our country, we have some names: Conray, Visotras, T, diagonal, and as I told earlier, the iodine contrast and urographene. This is a newer one. Okay. The usual dose is between 20 to 60 ml. That is according to the weight of the patient. What all do we need to do an angiography? We need a C-arm. What is a C-arm? Do you know what is a C-arm?
No, sir.
It is a X-ray device. Normal X-ray device will be like this. You will have one detector and you will have a X-ray emitter, and you will have the person here, and this will read, and this will go into a computer, or this will go into a print. But what is C-arm? C-arm is a device which can be rotated like this. It can go horizontal like this, or it can be vertical like this. This is usually used in OTs or in angiogram, where you can place it in either AP view or a lateral view. There is also something which has come recently known as an O-arm. A O-arm is nothing but it's a CT is nothing but excess of X-ray in all directions you have one. So this thing, if you place the human person here, it can take X-ray from any angle. This is called as an O-arm, a C-arm and a O-arm. Okay. Auto injector, syringes, heating devices. Why? You should heat to the body temperature before a contrast is put, because you should not put too cold or too hot. High pressure mechanism. Okay, that is because you are going in an arterial way. And control panel where you monitor the patient, image intensifying screen, that is the monitor, and a sliding table. Why? You want to move the patient according to your convenience to different parts of the C-arm, or you move the C-arm. Yeah, this is a picture of the equipment that is there. This is a C-arm because it looks like a C. Here we have the X-ray emitter, and here we have a sensor, and the patient is usually sleeping like this, and wherever the part you want, this will move. This can also rotate like this to become a horizontal like thing, like this. Okay, here they have the screens here. This is for the lights for the surgeon, and on the screen they visualize what is happening. What can a person who, when suppose I am taking my patient to do an angiogram, and I want to do an angiogram on Mr. Ramesh, and can I be standing there simply when he is going undergoing, or should I take some protective measure for myself?
Yes, sir.
Yeah, we have to take some protective measure. Which metal do you think is a good blocker of X-rays? Anybody have any general idea on this?
Lead, sir.
Yeah, lead. So ideally, I should wear a lead apron. And usually, how OTs are designed is these walls will be thick concrete lined by lead. So it's a main box-like structure. And even though it's a glass, you need to wear a lead apron and stand there. Otherwise, it can cause effects such as nausea, vomiting, and long-term malignancies, and also oligospermia. Oligospermia is decrease in sperm counts. Okay, we have I have a small homework for you. There are different colors of needles available or cannulas available. Please go back and read. 16 to 22 gauge needles are available. Which needles are used for what? Okay, this is not of my topic, but still you can go and read. And do you think a 16 gauge needle has a thicker needle, or a 22 gauge needle has a thicker needle? Do you have any idea? Have you seen your hospitals? Which one is thicker?
We do not use any of these needles, sir.
Okay, I don't know what you use. I'm sorry, but yeah, the 16 gauge needle is a thicker one for giving IV fluids. And when a polytrauma patient comes, you used to have a thicker needle because you want to give blood, or you want to give a fluid very fast to the patient. Okay, this is a 16 gauge needle, which is thicker one. As the number increases, the gauge of the needle decreases. Okay. So we have a puncture needle with a stylet and a cannula. What is the stylet? Stylet is the structure which is present inside the needle, and then you have a cannula. This thing which is going pulled out is the stylet, and the outside thing is a cannula. Large cannula size of about 1.6 millimeter is there. Then we have a flexible guide wire. Why do you pass a flexible guide wire? Because you want to reach into a specific artery, and you through this you pass this guide wire and reach where you want to reach. Okay. This is a method of catheterization which is not important, but I still go through it. You insert the needle, then you place the needle in the lumen of the vessel, that can be an artery or a vein. Then usually you enter through the femoral artery because it is wider, thicker, and easily accessible for the surgeon. Then you insert the guide wire through this, and this guide wire you manipulate and remove the needle, and you go forward with a threaded catheter into the area of your angiogram. Iotography, by the name it says iotography. That is, you are seeing the aorta. It is for the visualization of aorta and its branches. Okay. It is also useful for placenta and pregnant uterus visualization, but It is not routinely used because of the harmful effects of X-ray. Though if you want it in case of emergency, like if there is a congenital anomaly, placenta is, you are fearful that the placenta doesn't have an appropriate attachment, it is done very, very, very rarely. Okay, then we have a uh, this is what is it called as pudding of dye, because the placenta is like this and there are numerous vessels are there, so it will look like a huge pudding which is colored. Okay, and abnormal implantation, as I told, can be detected. Also, it is useful in demonstration of renal architecture. We saw in the first slide that brain architecture was available, and now renal architecture you can see. Okay, uh, uh, one is a presence of a single kidney, other is a presence of low-lying kidney, and if you have a horseshoe-shaped kidney, that is, kidneys are like this. Two kidneys are attached and they are not separated. Then, if you have renal hypertension, you will have either the small size kidneys, or you will have only one kidney, so you can have a renal cause of hypertension. Uh, During development, I would like to add one more small point. Um, what happens to testicles is testicles move down. Okay, so if you want, if you don't find the testis in the scrotum, you, that means you have to look above. Whereas in case of kidneys, no, kidneys are present lower and they start ascending up in the body. So if you don't find kidneys in the normal position of this, like that is the paraspinal region, they are extraperitoneal structures. What you have to do is you have to look for kidneys below. Always testis you have to look above, that is the inguinal region and above, and kidneys you have to look below. This is a normal iotogram, which we have the abdominal aorta that is being shown, and the branch of the renal artery that is there, and the mesenteric artery. Mesenteric arteries are arteries to the intestine. Okay, and we have the common iliac arteries and the various branches of it, and you can see the clearly how an artery is visualized. When you can, when you need to know, you can look for an aneurysm, you can look for a rupture, you can look for like opposite sided aortic arches, that is uh, dextrocardia or dextro version of the body, what we call as that, you can see through these images. We have commonly used techniques for abdominal artery. This is that the needle is introduced to the 12th rib. Uh, I don't think this is all important for you. 5 centimeter on the left or more, that's all okay. And we use about 10 ml of the 10 ml syringe, and 5 ml medium is injected into the, for screening purpose, and then we inject 40 to 50 ml in shortest possible time. Why shortest possible time? Because he can go in for anaphylaxis, and you should keep ready your adrenaline beside the patient before doing all such procedures, because patient will collapse. Okay. This is, we have seen retrograde transfemoral aortography. We have also seen retrograde barium swallows that we put through the rectum and later have images of that. And what we do is here we go through the femoral artery, and the inguinal area is prepared and dried, that is, it is cleaned with betadine, and a small incision is made over the pulsating artery and punctured with the needle that we use. We saw that later is called a Seldinger needle, and a number is not important. And we, as we told you, we pass a guide wire, we remove the needle, then we go into our abdominal artery, and then that is aorta, which you want to see, and with the help of the fluoroscopy, we visualize this and take pictures of it and come at outcomes that we want to look for. Cerebral angiography, the second one, what you do, you want to visualize the brain. Uh, in that we have first carotid angiography is for the lesions of tentorium cerebelli, and for anterior two-thirds of the hemisphere. Okay, these needle names are again not important. We enter through the common carotid artery, and again we go to the place where we require, that is the usually the anterior two-third of the hemisphere, and Thus, you can get the image of the brain parenchyma or the brain blood supply. Uh, how do you know that how you have entered into the artery? Always you will have a jet of blood, and it is not usually controllable that easily. And for the carotid angiography, we take the 10 ml of contrast dye, that is usually urographene for the brain, or coronary 280 or visotras 370. These are nothing but the different brand names that are available of the dye, and we are rapidly injecting the dye. And when do you take the first picture is within 2 seconds of the uh, contrast material that is inserted. And whenever possible, you have to take an AP and lateral view, which we take with the C arm that is possible. Okay, here we have the anteroposterior intercarotidogram, where you have the external, the internal carotid artery that is shown there, and that is splitting into the posterior and the anterior communicating artery, and thus going to form the circle of Willis. Circle of Willis is the main blood supply of the brain. This circle, what you call it as circle of aneurysm, and usually you will have a berry aneurysm here. Looks like a berry. That is why fatal condition if it blasts. Okay. Then we have the posterior cerebral artery, and here we can see the beautiful brain parenchyma following the angiogram and on the lateral view. And this is the posterior communicating artery and forming the internal carotid artery, and anterior and middle cerebral artery that is forming from the internal carotid artery. Okay. Vertebral angiography, again, we are going to see the vertebral artery blood supply, and we saw that the carotid was for the tentorium cerebelli, and anything which is below that is through the vertical artery, and the needle is held that is perpendicular to the neck and inserted into the transverse process of the 7 cervical vertebra, as they say. And these things are not important, just you can listen, that's why I'm going fast. And again, how do you know you have entered the vertebral artery? Because you will have a gush of blood, and you can also enter through the brachial artery before its division at the right elbow joint. And more amount of dye, that is we use 10 ml for as we saw for the brain, and here they say we have to use 30 ml of the dye. This is the vertebral artery that is visible. These are normal views on that. Now, coronary angiography, this is a little more important. Why? Because myocardial infarctions are more common, and what we know as MI in young is becoming more and more common in our country. Little bit of history. Dr. Mason was the first person who discovered this. And why we want to see? We want to see the blocks. We want to see the atherosclerosis that is there, and where the blood supply is blocked. Which of the, there are two arteries, okay, left, what we call as left and right arteries of the cardiac arteries are there. Which artery is more important, do you know? Because one artery is supplying major portion of the heart. Do you know which artery is more important in the heart?
Left, sir.
Yeah, usually 75%, like what they say, that 75% of the blood supply to the heart comes from the left, because it is giving two circumflex branches covering the major portion of the heart. Okay, just since we have come to heart, just a little bit of more history. Who discovered stethoscope? Do you know who discovered stethoscope and why?
Okay.
I wanted to find out that it was discovered because the I can get some disturbance from someone here. Yeah. I don't- okay. It was discovered because the scientist or the doctor who discovered stethoscope. Initially, the heart sounds were heard by placing the ears on the chest, but later on, as he felt very uncomfortable on placing his ears over the female chest, so later he discovered a stethoscope, which was initially looking something like this, and later we have a stethoscope which is looking something like this. That is why it was discovered. What do you want to do in a coronary angiogram? Any patient with heart pain who comes to you, you do first an ECG, which we'll discuss later. Then you rule out any MI causes. Then you do an echo, which I'm going to discuss next today. And if in echo also nothing is there, still you suspect an heart disease, you can go for a coronary angio. Okay. Fine. What do you want to see? We want to look for coronary arteries, branches, and collaterals, and any major blocks, which is the major artery here, the left coronary artery or the right coronary artery you want to see, and the bifurcations, the length, and how its thickness is you want to see. Okay. Where all you can go into the heart, you can go through the femoral artery. One is that. Other is you can go through the upper limb. Okay. Uh, Yeah, what all can you see? You can see the narrowing of the artery. You can see complete blocks. You can see uh, new vessel form. Like if it is a minor vessel that is blocked, you can see new vessels that are formed into the area, which can be seen on an angiogram. Yeah, that's it. You can see this is an angiogram showing the left coronary artery, as somebody answered already. We have the left dominant coronary artery and the right which is less. That is, sometimes in 25% of the people, the right also can be dominating. That can sometimes be tricky. And based on where the block is, you will have your reciprocal changes in each reciprocal changes in the sense that part of the heart will not be functioning properly, hence will not be giving out any electronic potentials that has to be read in the ECG. Now we are coming to the renal angiography. I told briefly that renal angiography is for the kidneys, and what you can do, you can take fluoroscopic images of the kidney, and you can before all that, how can you go? You can go through a translumbar puncture by posterior view, and this is not important. You can look at the renal arteries, aortas, and other major branches of the artery that is visible. This is a beautiful picture of a renal angiogram. You can see the renal artery and its divisions into different pylorus. And what is this that is seen here? Yeah, what is that is seen there? Come on, what is this thing that is come like this? That's just common sense. Come on, man.
Renal artery, renal venous,
Sorry, louder, please.
renal medulla,
Sir,
Sorry.
screen, please. Screen, sir. It isn't visible.
Yeah, this one. What is this thing that is going into the artery?
renal artery, renal venous,
Okay, you put the cannula, then you insert one what guide wire, and then later you pass something with the thread, no, to inject the dye. That is the same thing that is injected into the renal artery. That is what this image is showing. They have entered here and gone into the renal artery. Okay, that is what is showing there, and that is nothing but the threaded wire that is passed for your dye injection. Okay, coming to the benefits of angiogram. Uh, This shows where the block is by the plaque or an emboli, and you can pinpoint which blood vessel is blocked, and you can do what do you do if there is a block in an artery? What do you do if there is a block in an artery? Yeah,
Catheterization.
if there's a block in artery, depends
Yes.
on whether it's a major or minor artery. Okay, if it's minor artery, you just keep it like that, and you wait for your body to work. If it's a major artery, what do you do? Suppose I am having a heart attack, and my left, first of all, if my left cardiac artery is blocked, I will not survive. But still, if I am lucky enough and survive, what do you want to do? Do you want to remove the block, right? That is why first 3 to 6 hours are the golden hours of my life.
Yes.
Okay, you have to remove the block. Either you can do a stenting. Stenting is you put like this. You put a spring-like structure which is like this, and you dilate it so that it will hold in place and the blood will flow. Or you can do a embolectomy. That is, you use a balloon and you pull it back, which is not rarely done because it will go in somewhere else. Other thing is you can do a, if this is blocked, you can give a bypass. Okay, yeah, fine. Uh, Based on this angiogram, you can decide what is the grade of the injury that is there, and uh, whether you want to go for a stent, uh, or whether you want to do a bypass surgery. Uh, and you have a very clear and accurate picture, and it is in front of your eyes, and you can consider the surgical procedure that you are going to do. Again, we have already discussed the risk. What are the risks of angiogram? More than knowing what is the use, you should know what is the problem. Yeah. Today, I think everybody is very dull. No response is there from your end. Yeah, internal
Internal
hemorrhage
hemorrhage,
can happen. Next,
spreading of infections to other
yeah, it can
regions,
happen. Then,
Aneurysm.
sorry, Abhityan,
Aneurysm.
Adityan. Yeah,
Aneurysm.
your voice is not that clear, man. Okay, what can happen is one is okay, it can bleed.
anaphylaxis, sir.
Anaphylaxis can happen. Pain can happen. Swelling can be there. Why swelling? Swelling because you have punctured an artery and then you have closed this, and this artery can leak here and become a hematoma. Okay, bleeding, pain, and swelling, and allergic reactions can occur in people who are allergic to iodine, and you can have renal failure or a liver failure. Then heart heart can go into overload because your artery is blocked to the heart, and you are putting one more wire into the artery, more work for the heart, and it can go for a congestive heart failure. Okay, that is why it can go for a failure. Yeah, that is, we have finished angiogram. Any doubts? Any doubts, guys? Something went in or nothing?
For now, no doubt.
Bouncers. If you have doubts, please type it, okay? Because I sometimes the voice is not that clear today. I'll give 3 minutes. Any doubts you can ask in the chat box. Okay, I didn't see this. Fine. Okay. Everybody's dull today. Finished. Finished. Okay. Internals are over. Very good. Renal Linac is the right answer Ajit has given. Ajit, that you are right. Linac found out the stethoscope. And yeah, any doubts? Please put in. I give you 3 minutes for that. Okay. So there are no doubts. Something like this, an initial stethoscope looked like. Okay, first it was like a conical thing and a big box, a cone, which was kept on the ear. Then they made something like this for the purpose of hearing. Then again, it was like then we had something like this. Okay, with the two tubes and that huge thing, and this is the diaphragm and this is the bell we had here. And the first stethoscope also something like this. The bell was kept on the ear and present. And now we have the single lumen ones where two pipes are going in one inside each other. And now we have electronic stethoscopes which can record and even uh, like play the music to your ears if for later purposes for that. And those are very costly, of course, 50 to 1 lakh rupees. And that is about stethoscope. So if we are, I think we have 1 more minute, and if you are interested enough, we'll go to echo, or you want me to stop because it's almost 7. Should we continue to echocardiogram, or should we stop today, maybe next week or tomorrow next week? What should I do? Yeah, should we continue the class or should we stop? Or you're tired? Weekend.
Yes.
Fine, sir.
Shall we stop? Or shall we do echo? Yeah, please type in. Anything is okay. It's okay if you're tired. We can do it some other time. Or if you want me to continue, I will continue. If you have any doubts, we can address that. Please type in what you want me to do. Like, it's enough for today, Angio, or should we do echo also? Okay.
Sir, we'll recall the class, sir. We had function today.
Sorry. The voice is not that clear, Govindan. You can either type in. I feel that is better. Yeah, yeah, that is better. Yeah. Govindan, what do you want me to recall? Like which topic? here. Yeah, briefly we'll recall full thing till now what we have finished or only angio.
Only angio is fine, sir.
Okay, okay. Chaitra, she's telling she has some network issues and we could continue next class. Okay, another 15 minutes we'll recall angio, then we'll stop. And yeah, if anything is going above your head, just tell me. No, I don't know like how you're feeling about the class, but uh, I'm always there. Okay, uh, and these things, it is, I know it is like a very big bouncer for you guys, but I believe me, it will help you some or the other day. Like you will know something better than the rest. That will always make you stand out. Okay, we'll have a fast revision of angio, but I want you to speak with me, and I want you to. Okay, I know it is very dirty. Okay, okay. I'm sharing my screen, and we'll have a fast revision of 15-20 minutes, and then we will have a good Sunday tomorrow. Okay. Is the screen visible? Yeah, it is. Fine.
Yes.
And I want you to speak. Please don't be mum for another 10-15 minutes. Okay. We are working on angiography. Okay. Okay. We had a class of angiography. I want to know what is the difference between angiography and angiogram. Anybody? I have a doubt now. Angiography is the process of doing an angiogram. Okay. And angiogram is the image that you get later. Okay. Then we know that we take X-ray images for the after injecting the contrast, which is usually an iodine material, and we know that we can see artery, veins, and lymphatics. First, we see the artery because we are injecting into artery. You can inject into vein also, but it's a slower process. And from there, the dye can get absorbed into vein, and you can look at the veins also. Then you can look at the lymphatics also if there is an edema. What are the indications? You want to look for tumors, you want to look for stenosis, you can look for clots or blocks, you can look for aneurysm, that is dilatation of the artery, and we saw about berry aneurysm, which runs in families, which is a uh, dreadful condition. Then we can look for heart diseases. Then you should not do if the person is having any bleeding disorders, when he is having any allergic reactions, when there is an uncontrolled hepatitis, that is his blood pressure is more than usually 150 to 200 systolic. Okay, impaired renal function, that is his creatinine clearance is low, and he is unable to go undergo any surgical procedure, so you cannot do a angio and waste your time. Then there is pregnancy, of course, for placental mal attachment, you can do a angio in very rare cases, and in active infections, you don't do an angio. Next, for a contrast material, how it should be? It should have low toxicity, high specificity, and high chances of blocking X-rays, and low viscosity. One is always preferred, and it should not be toxic to the liver and kidneys, as we saw earlier. However, such contrast materials are not available till date on the market. So we have examples such as Conray, Visotras T, Diagenol, Eurographin, the newer one, and we use 20 to 60 ml. When we want for lower limbs and upper limbs, you take more amount. When we want for brain, we take the lowest amount is what we studied. Next, what all we need? We need an X-ray machine. It could be a CR or an OR. Then we have an injector. Then we need a syringe. Then we need a fitting device to preheat the contrast material. Then we need a centrifuge to preheat the contrast material. Then we need a
No, sir.
Sir, I think he left the meet.
Okay. Connect.
Is the screen visible now?
Yes, sir.
Yes, sir.
Yeah.
Yeah. Yeah. We were discussing this, and we have iotography, that is for visualizing the aorta. This is the abdominal aorta. This is how aortogram will look like. Where do you go? Thoracolumbar region is where you enter the aorta. Then we have retrograde through the femoral artery, and the needle for this cell is just this. Then we have cerebral angiography. This can be done by carotid or vertebral way. Carotid we use, as we know, we use very less amount of contrast machine, that can be urography or Mondre or visotrast. This is the internal carotid artery diagram which we have, and this is how it looks on a diagram. And this we have the vertical angiography, where we use more than the cerebral angiography. And then we have the coronary angiography, that is for heart, and it was done by Dr. Mason. And what are the, we want to see where the block is, we want to see any anomalies are there, we want to see the presence of normal and the collateral arteries that present, and any bifurcation, calcification, thrombosis that is there on a heart. You can go through the upper limb or you can go through the lower limb. However, lower limb one is preferred. Also, you can see for that word catheter that is being passed here. It has come from the lower side, and it is going into the artery desired, that is the right heart artery. And you here they have visualized the narrowing. There is the atheroma. Atheroma is nothing but the fat plaque that is there, and you can also see any blocks. You can see any collaterals. You can see any new vessel formation that is there. This is the left coronary artery and right coronary artery that is there. Normal. Renal angiography is for kidneys. You go through paraspinal region, and directly you can canalize the renal artery that is there. Then where we get to the benefits, where we can find out where exactly the block is, where we can see if there are any blocks, or you can see if there are any plaques that are present. Then you can see what percentage of the artery is blocked. You can also see the need for a surgery or an intervention. You can also describe where the block is, and in blood vessel the block is, hence plan your surgery. What are the risks? There can be pain, bleeding, and swelling, and there can also be anaphylactic reactions that are going to happen because of the contrast being an irritant. So other things, what can happen is you can have an instantaneous heart failure or a myocardial infarction, when that is an heart attack when you are doing this procedure. So you need to be very careful, and it should be done in a care unit. That is it for today, and yeah. Um, so you want me to take class tomorrow or next week? You want to take class tomorrow or next week? Please put it in the chat box or something, or let. Okay. Nutna. Fine. We'll take next week. And please don't be battery low next week. I want you to read and come. At least if you look once and come, you will find some interest. And of course, few of you are responding. I want all of you to respond. And yeah, that is it for this week. Angiogram. Next week we will do echo. I'll take a shorter session better because I feel you get bored in 2 hour sessions. And please respond. It should be a two-way process. And if you talk, it is nice. Of course, a few of you are very active. I'm very happy about that. And it's a new year again. And thank you. And see you next week, next Saturday or Sunday or a Friday. I'll let Ganesh sir know. Okay. Yeah. Thank you.